Hello, how are you today, Jake?
Good, how are you?
Hello.
Good, good. My name is Joey. I will be your student nurse for today.
My name is Evelyn, and I'm going to be your nurse practitioner.
Hey, so can I get your name and date of birth?
Jake Henderson, 22005.
Perfect. Okay. Jake, can you tell me what's going on with you?
So like my hands have been real stiff and tense in the morning, like my joints get real swollen, and it's just really bad in the morning.
Okay.
He has a hard time like getting out of bed in the morning.
Gotcha. Okay. When would you say that has started? Like when it first occurred?
I first noticed it, how long ago?
I'd say about 3 months ago.
About 3 months
3
ago.
months ago.
Yeah.
And it's been consistent since 3 months ago?
Mm-hmm.
Okay. And can you explain to me some of like the severity and the symptoms?
So for like, it's really bad, like once I wake up for like an hour or so, like I can't really make a fist or anything, like clench my hand at all. And then like grabbing utensils, like forks, spoons, cups, I just have a hard time holding on to it.
It
Okay.
takes him a second to like warm up his joints. for
Is
the
there
day.
any other like complications like fever or anything else that has been
Not that I really
affecting-
noticed.
No? Okay. All right. And then on a scale of 0 to 10, 0 being no pain at all and 10 being absolute worst pain, how would you describe the pain level?
Like a 6 or 7, yeah.
Okay, cool, perfect. Okay, Jake, so real quick, what we're gonna be doing is a quick assessment on your joints and your pain levels. Do you mind if I?
Yeah.
Okay, so real quick, so what I'm gonna have you do is just follow my lead. So start off from right here. You're gonna open your fingers and just tell me when it hurts. Tell me when you feel any pain.
It hurts about like right there.
Right here, you can't close all the way? Okay, gotcha. Okay, what I'm gonna have you do is squeeze my hand real quick, as hard as you can. Okay? Okay, I'm gonna do your fingers. Tell me if you feel any pain.
That hurts.
That hurts? Okay. Okay. Can you, with your whole hand, can you make a fist?
I can get to like right there, and then that hurts a lot.
Gotcha. Okay, okay. And then with your wrist, can you flip them? Your fingers. Okay, gotcha. All right. Now next, I'm gonna do an assessment on your knees real quick. So what I'm gonna have you do is have your feet come to the side and just go as tolerated. If you feel any pain where you can't extend your knees, don't extend it too far. Okay. But just tell me when.
That hurts.
Right here.
Yeah. That
You
hurts.
can't go further than this.
Mm-mm.
Okay. Okay. And your right leg.
That hurts right there.
Gotcha. Okay. Okay, thank you. Awesome, Jake. Well, with that conclusion of the assessment, I'm gonna have my nurse practitioner talk to you about your labs and your values, okay?
Okay.
Hello, Jake.
So
I'm going to be your nurse practitioner. I viewed your labs, and it does look like you indicate rheumatoid factor, which indicates it's elevated, which could mean you might be having a flare-up.
all right. So is it like really elevated or just like a little elevated?
So yours is showing about 60%, and the normal level is about 20%.
About 20. Okay.
Yeah. So are you taking any of your medications as prescribed?
I've been taking my methotrexate pretty regularly, I would say, and then I've been taking ibuprofen for pain.
Okay.
He's
And-
usually pretty consistent with his medications, otherwise he'd be in a lot of pain.
Okay, that's good. Do you have any side effects from the meds?
I just feel really tired all the time.
Tired? Okay. So Trexol can cause immunosuppression, so you're gonna report signs of infections like fever, pain, muscle aches, and also you don't have any live vaccines.
So like flu-like symptoms I should look out for?
Yes,
Okay.
correct.
Thank you, Evelyn. And Jake, I have a few more questions for you before we proceed.
Okay.
Okay, Jake. So what do your daily tasks look like?
I like do my hair and like just kind of mill about the house, and then every like couple times a week I'll like go out to the store.
Okay. Do you drive or do you walk there?
Somebody drives me.
Somebody drives you. Do you ever try to walk?
He makes an effort, but it is a little difficult for his knees to go long distances. So we do try to like sit down and take breaks
Gotcha. Okay, perfect.
Okay, Jake, we can involve physical therapy to improve hand mobility. Would you be okay with that?
Yeah.
Okay.
Perfect. Yes, it's very important. Physical therapy I do recommend because it will help with your flare-ups and your joints, and you know, with physical therapy, they're going to teach you how to do range of motion, right? What I was doing during my assessment. So with that being said, I'm actually going to show you some, I'm going to teach you some things, with your fingers. You want to try to do this, try to close them, at least try to do 10 sets of these. Like try to do them whenever you're in your free time, try to do this as much as you can, right? And so when you're in supination, you're going to want to try to close and flex your hands as much as possible. And I know you can't close them like fully, but try to close them as far as you can. Our goal is to start off at 25%, then 50% next week, and then the goal is to get 100 within a few weeks, right? And so same thing with your leg. What you're gonna want to do is whenever you're dangling your leg, try to flex it as far as you can, all the way, full extension, right? And I know you couldn't do it during our assessment, just go halfway. Go halfway, and then next week try to go like more than halfway, all the way to the point where you get to 100%. With that being said, we are going to put you on a fall precaution, a fall prevention precaution. What that means is, we're gonna come check out your house. We're gonna make sure that you have your place all tidied up. We're gonna make sure there's no cords in the way. There isn't any, loose mats, rugs, or anything that can, hurt you in the end. So.
I do have like rugs at the house. Do I have to get rid of them or can I keep them?
No, you don't have to get rid of them. We just gotta put them away for the time being until you get off that fall prevention precaution.
Okay.
Does that sound good?
Yeah.
Perfect.
Okay, thank you, Jake.
Thank y'all.
Thanks, Jake.